Good afternoon, everybody, and thank you for your patience and welcome to the Health and Human Services Committee room this afternoon. I'm going to have committee members introduce themselves, starting over to my left with Representative Lemelin.
Good afternoon, everyone. I'm Michael Lemlin. I represent House District 53, which is Chelsea, Randolph, Pittston, and Dresden.
Good afternoon, everyone. My name is Ann Fredericks. I represent House District 143 in Sanford.
Hi, everybody. I'm Representative Dan Shigori. I represent House District 55, the communities of Hollowell, Manchester, and West Gardner.
Good afternoon. My name is Julie McCabe. I represent District 93, part of Lewiston.
Caught me off guard. I'm Representative Annie Graham. I serve the people of North Yarmouth and the majority of Gray, House District 105. It apparently is a little over freezing, but it's going to snow this afternoon, so please be careful driving home.
Hi, I'm Representative Lucian Daigle. I represent House District 1, and that was the #1 place to be in Maine this weekend because of the Can-Am.
They went to the dogs.
Hi, good afternoon. My name is Flavia De Brito. I represent House District 64, which is part of Waterville and part of Winslow.
Hailing from District 116 in Portland, I'm Sam Zager, representing the off-peninsula parts of the city. Thank you so much for being here.
Good afternoon. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, along with 16 communities in eastern Hancock County, beautiful down East Maine.
And Representative Griffin on Zoom.
Good afternoon, everyone. My name is Abigail Griffin. I represent House District 34, which is Glenburn, Levant, and Kudeskeg.
Good afternoon. I'm Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, where I live, and parts of Kittery and South Berwick, and I'm honored to serve as this committee's House Chair.
And good afternoon, everybody. I'm Senator Henry Ingerson. I represent Biddeford, Arundel, Dayton, Hollis, and Lyman in the Maine Senate, and I'm pleased to be the Senate Chair of the Health and Human Services Committee. And we happen to have Anna Broom and Sam Seneff with us today as analysts. Thank you for being here today. And Sophie Dubé as our clerk. Welcome, everybody. We're going to start right off. We have some amendments to the supplemental budget that we're going to be adding in and voting on today. I will start off with you, Representative.
You, Representative, meaning me?
Absolutely you. Yeah. I don't know why your name escapes me, but only briefly. Meyer.
Yes,
Yeah.
Representative Meyer.
Go ahead, Chair Meyer.
Mayor, I'm looking through two packets of papers here. So oh gosh, yes, thank you. It's already been a long day.
75.
Yeah, 875. Yes, so I would like to make a motion to add LD 875 to the supplemental budget. This is an act to fund essential services for victims of domestic violence at $4 million annually.
Have a second on that? Okay. Motion and a second to add LD 875 into the supplemental budget?
Yeah.
Yes.
We do have copies of LD 875 for those of you that don't have it.
Thank you.
Yeah.
Thank you. Very good. This is totally new.
Yeah. There may be a number of things you receive in a minute that are surplus to requirements. In other words, you're getting a bigger packet. We don't know how many you're actually going to get.
Thank you. Thank you. It would be nice to have them ahead of time, but.
So you'll have to fish around for 875.
Okay. Is this currently on the appropriations table? I
It
didn't
is.
hear. I'm sorry. I was
It is.
trying to find
I'm
a
sorry.
pad of paper.
Yep.
Okay.
It is. This was, I believe this was a unanimous ought to pass in the first regular session. There's a motion and a second.
Any discussion?
Question.
Yes.
Thank you, Mr. Chair. Just wondering, it says to replace in et cetera, anticipated reductions in grants to the department. Is it the $3 million that we're proposing is the anticipated reductions, or is it half of that is
The fiscal note on this bill is 4 million.
it's 4 million?
Yes. 4 million, LD 875 should be in your packet.
So I got a second change in it.
Thank you for the clarity. Thank you.
Sure. Yes, Representative Graham.
Thank you, Mr. Chair. I just wanted to point out that this was passed in the previous session, passed to be enacted as an emergency. So it did receive 2/3, and it's been sitting on the appropriations table, and therefore we're thinking that it'd be a good idea to get it into the budget as opposed to waiting for it to be looked at on the appropriations table.
Okay, we have a motion and a second. All those in favor of putting this into the budget? Okay. Next, we have LD 2212. Representative Meyer, this is long-term care ombudsman, staff shortage, I believe, in Penobscot County and Aroostook.
Aroostook County.
Actually, LD 2212 is actually the budget.
Oh, okay.
This is just the testimony
This is a-
from
sorry.
the long-term care ombudsman telling you what their shortfall is.
Looks like this in your packet.
Yeah, because we didn't have a bill, it's just the testimony.
Okay.
So it's our understanding that there is a position, we're lacking a position in the long-term care ombudsman office for Aroostook County. There is presently no one to provide the ombudsman services in the whole of Aroostook County. And so I would like to add $111,000 ongoing for this position into the supplemental budget.
I'll second the motion.
Thank you, Madam
Yep.
Chair. I'm in support of the proposed motion. However, I wondered how we got there, that the largest county in our state of Maine didn't have the representation.
Nicole, would you like to come up and talk a little bit about, this is the long-term care ombudsman's office.
Good afternoon.
Welcome.
Yeah.
Oh, go ahead.
Musical chairs.
I can go.
He's
Sorry,
fine.
Nicole.
No, you're fine. Yes, Representative. We cover, but we have to staff it from different parts of the state. So we have a regional ombudsman that's assigned to different territories of the state. So what they do is when we don't have coverage, we outsource it from a different part of the state where there's coverage already. So it's really just all hands on deck when we need coverage. So when a case comes in, we outsource it to a different regional ombudsman that covers a different part of the state.
So with this funding request, this will give a designated exclusive position to Aroostook County.
Yeah, so historically, we did not have a regional ombudsman. Right now, we do have a regional ombudsman covering Aroostook County, but the funding ended in July. So, yeah. So because of that funding ending, we're just mitigating funds to keep that individual in that spot, but we haven't been able to hire a regional ombudsman that is vacant currently, and we had to lay off another field individual that was our associate director last year to compensate, to move the funds to secure the Aroostook County position.
Okay, there's a motion and a second. Any further discussion? All in favor? Thank you.
Next, we have LD 814, otherwise known as the Older Mainers Act. It's currently on the appropriations table. It provides funding to area agencies on aging for community-based services and programs to support older adults. And we heard a lot of testimony on it last year. The fiscal note is $9.75 million per year ongoing.
Okay. I would move LD 814 into the budget.
Do I have a second? Second by Representative Shugori. Discussion. All those in favor? I believe this one's on the table as well, 1746.
Yeah, this is the rest of the oral health bill.
17. Next up, I have LD 1746, an act to reduce dental disease and ensure access to essential preventive dental care among Maine children. This was dealing mostly with mobile dental services, if you remember from last year. Currently on the appropriations table, and the fiscal note is 676,697 for the current year and 868,776 for the following year, 26-27.
Some of this has been funded. The positions were funded.
I believe that's correct.
Yeah.
Okay.
I believe this is for the programming part.
Okay,
I believe,
go ahead.
I believe this is for the programming part.
Okay.
The testimony that you heard at the public hearing said that the two positions were included in the budget last time. So
what does that leave us with then on this bill?
Not the same.
right?
Not the same.
I think it's the,
Oh, 649, 466.
correct.
Yeah, 466 and 649 if you take
Yeah.
out the positions. Okay. Have a motion and a second on that bill? Yes, Representative Zager.
Thanks, Mr. Chair. I move LD 1746 into the budget with the except for the positions.
Yeah.
Thank you.
Have a second? Representative Shigori seconds. Discussion.
Was this also a unanimous report out of this committee? Do we have that? Was it? Okay.
Yep. I think.
It was unanimous.
Okay.
Yes. Okay. Unanimous report last April. All those in favor? Now we have a bill brought to us by Representative McCabe, LD 2125, an act to sustain access to children's residential care services. This bill,
So one time.
Yep.
General fund appropriation of $1 million to establish an emergency fund for children's residential care facilities at risk of closing.
I have a motion. Representative McCabe.
Thank you, Mr. Chair. I would make a motion to add LD 2125 to the budget.
We have a second by Representative
DeBrito.
Discussion further? All those in favor? Next request is LD 1955, heard this year, an act to increase childcare affordability and early childhood educator stability. Actually, we had a work session on it this year. It was heard last year. We carried it over. What it basically does is it retains the provision of the bill that requires DHHS to develop a long-term plan for the financial stability of the Maine Childcare Affordability Program. Changes the date to no later than the 15th of December, 2026. It allows the commissioner to accept donations and grants for the program for any source. It clarifies that funds to support the program are non-lapsing funds and ongoing funding of 15 million in fiscal year 2026 to fund the program. We have a motion on that bill,
I would move 1955 into the budget.
and I will second that. Any discussion? Yes, Representative Moore.
How about Senator Moore?
I'm sorry. You got it, Senator.
What was the vote on that? I know this was the majority report. What was the
This was party line.
party line? Okay,
Yeah.
thank you.
All those in favor? And opposed? The next request comes from me, LC 2066, an act to establish a child care employment award. That basically what it does is it takes a pilot program and makes it an ongoing program, establishes it into statute. And with 3.122 million a year. And it was a divided report because I think the minority report was, it was all good except for the staffing, I believe. We have a motion on that one?
I would move, is it 2066?
2066.
2066 into the budget.
And a second. Second by Representative DeBrito. All those in favor? And opposed? I think that finishes it.
No, it doesn't.
You got one more?
There's two more.
Okay. I don't, I see that. Wait a minute. I do.
721.
All right. Excuse us a second.
Yeah.
Why don't you go ahead, Senator, Representative? Have, let's do,
It's Annie.
okay.
721.
LD 721,
It's Annie. She'll
Okay.
make the motion.
Representative?
Thank you, Mr. Chair. This LD 721 was passed unanimously out of committee and passed under the emergency preamble in the House. It provides one-time funding to support the full implementation of 5 certified community behavioral health clinics, also known as CCBHCs, certified the state as part of the federally certified community behavioral health clinic Medicaid demonstration program. I'll make a motion that we move LD 721 into the budget.
All those in favor? Unanimous.
Finally, I'd like to add LD 1061 to the budget. This is an act to increase community support for families in Maine. This is a bill to fund the prevention councils that the Maine Children's Trust operates in all of the counties here in Maine. It's got a $1.5 million annual fiscal note, and I believe there was a revised, there was a fiscal note revised down. So I'll get that information, but I would move that we include 1061 in the budget.
Right, I will second that. Discussion? All those in favor? And I believe that's,
So
I don't have one about the
do
letter.
we want to have a discussion about these VOCA funds and what the source is?
Sure, yeah.
Yep.
Do you want to take it off and start it?
Well, why don't we talk a little bit about the request that's come in about the VOCA funding and explain to the committee what is,
We'll tell you what we know.
okay.
Which is maybe not the same as what, I
We,
don't know.
we've known,
So
we know very little.
in the budget last year, if you remember, there was a $6 million shortfall in VOCA. You probably all remember that. And there was a $3 million proposal ongoing from the governor's budget, in the governor's budget, which was approved. In addition to that, there was one-time money to replace that funding, which was $3 million in each year. And I believe there is still there was a lot of testimony, I believe, on Friday in front of the Judiciary Committee joint public hearing, although the VOCA funding is generally speaking in your budget, about having that funding be ongoing to replace that missing VOCA funding. Our understanding, and you will need other people to talk more about this, is that that request has been reduced to 2 million, but you'd have to ask. There are some folks here that can
2 million
explain that.
one time?
No,
2
this is
million
the
ongoing.
ongoing. That's the
Okay.
shortfall is not 3 million, but maybe 2 million.
Okay, and was the VOCA funding in the budget, previous budget, in our budget?
It was.
We,
But it was sort of an odd one. It was in your budget, but Judiciary voted on it too. So
Okay.
the Appropriations Committee got 2 recommendations on VOCA funding last year.
okay. And is there someone in the room that can speak?
Believe so. Okay. There's the Queen, actually, one who knows all.
Come on up, introduce yourself.
Wow, I don't know about the Queen. Elizabeth Ward Saxel, Maine Coalition Against Sexual Assault. So I think I can fill in a few additional pieces.
Good.
So as you may recall, last session, you voted unanimously for LD 117, which was to fund advocate salaries from the base of 30s to get it to a floor of 45. We felt very good coming out of this committee and going into appropriations. And then in the middle of the night, we realized that it was not going to get moved into the budget. And so I reached out to the Maine Coalition to End Domestic Violence and said, I got a wacky idea, which is to say on that $3 million to backfill VOCA, if we don't need all that money, let's divide it between the two coalitions. And I used 117 as the vehicle to do that. So use that as the amendment. So what ultimately happened was we got the federal allocation after the close of session, because at that time we still didn't know what it was going to be, and we didn't need the full amount. And so the balance of it was divided between the two providers. I will add a really important footnote, which was that neither group were flat funded in their next contract. And so the result is hard to measure about like how much of that from the department went where it needed to be. But in any case, with the half that we got, we did raise advocate salaries. And so we went from a high, as you may recall, of 60% turnover for sexual assault advocates after we did not get this passed 2 years ago, to now below 20%.
Wow.
And in some areas, 10. Our workforce is totally stabilized as a result of this. We're deeply grateful. And because this amendment went on to the one-time VOCA funding, it meant that this is one-time money. And our advocates are smart. They've spent enough time in this building to understand how it works. And so if we are not able to move this money into the baseline now, come close of session, we're going to have the same thing happen. Folks are going to go and look for other jobs. And to be clear, they don't take other jobs because of the hard work. We surveyed them. It's because of advocate pay. In fact, folks were leaving us to go to work for CPS, which I know is also of an interest to you, but don't count that as a plus. Please count that as a minus. I know, right? Yeah, okay, yeah. You can take it either way you want, Senator. So we are seeking to have, instead of the 3 million, because again, we didn't need the full amount for the VOCA backfill, and I know this is confusing. We are seeking to make the 2 million ongoing in the budget. And so we are hoping that you all will finish what you started and help support these advocates in the out years from here. As the original bill you all voted in favor of was 3 million ongoing.
Yeah.
So it'd be less. See, we just saved you $1 million, right?
Senator Moore, question.
So thank you, Elizabeth,
Yes.
for being here. So what is the amount of money we're getting from the feds for VOCA?
Fun game, don't know. It looks like the fund is bouncing back.
Okay.
And so we're optimistic that there will be enough money. What we would do, which is what we did last time, which was say the VOCA backfill needs to be filled first, right? Because we work in collaboration with Pine Tree Legal Service for Maine Elders, the MCDV, the VWAs and the Victim Witness Advocates. That's the core of like this whole service set. So we want that to be made whole first, but we're not going to know until, I don't remember last time it was after the close of session. So when did you all get out? I don't know.
June, end of June last year,
I don't remember.
July,
I've tried to forget.
1st of July.
Yeah, so it must have come in like August. So we just don't know.
Any further
Yeah.
questions? Comments? Okay. So-
Thank you, Elizabeth.
Thank you. So it looks like we're voting on a 2 million appropriations ongoing.
That would be the motion. So it was going to be made.
And that's the motion. A second?
Second.
Second by Representative Shigori. All those in favor? Okay.
I guess the corner caucus. Ask for the corner caucus.
I'll take a short break and have a corner caucus. Took a little pause. Senator Moore.
But you want to have Sam go first?
Yes.
Thank you, Mr. Chair. Thanks, Senator Moore. I just wanted to elevate something, discussion that we had sort of had in committee regarding Maine veterans homes. And was it has to do with ongoing funding and how much can be drawn down. I'm not fully clear on the explanation that we've had to date, and perhaps we could, in a report back or in one of the line items, adjust that. I don't think it's quite ready for prime time at the moment, but perhaps we could get some more information from the department and maybe others tomorrow morning before our letter is due tomorrow afternoon.
Thank you, Representative Zager. Senator Moore.
Thank you. One of the other items that I just kind of wanted to, I could bring to the surface in our supplemental budget.
Can you give us a line?
Yes, I am. That's what I was just going to say.
Okay.
119 and 120, and then also 121 and 122 address the hospital rebasing costs, and they're changing the year from 2021, 2022 to 2023, 2024. In the years past, when we have rebased, we take a look at the cost, the main care costs that we had in that appropriate year. And the hospital actually pays a tax on that. And then there's some revenue going back and forth with it. In the past, there's been a line for supplemental payment to the hospitals to make sure that the hospitals were made whole, that they did not lose money simply because we were rebasing or choosing or setting the hospital tax to be from a previous year. So I'm thinking that we need to probably gather a little bit more information so that we can be able to be more specific about it. But I really do hope that we will consider making sure that our hospitals are made whole with this whole rebasing thing. So I'd like to bring that up again tomorrow in our conversation, if that's okay with y'all. Thank you.
So we have two items that we'll be talking about tomorrow. Anything else?
I think that's it. I think we'll have the letter drafted, and then we can, if there's any additions tomorrow morning, we can add those.
Okay.
Okay. I will also, we'll discuss finally the state of emergency language that we had discussed earlier on the governor's for SNAP, emergency SNAP.
Okay. Would you like me to do that, or do you want to do that tomorrow? Sorry.
Do it tomorrow.
Oh,
We'll
tomorrow.
finish it
Okay.
all up, get
All
the letter done. And okay. We ready to start work session?
Yes, we are.
Why don't you want to lead?
Sure,
Just start it.
sure.
So she goes, put some things over.
Yep.
Give us a minute. Take 2 minutes. Stand up and run around.
So we're switching gears to work LD 1932. So just give us a few minutes here to get settled.
All right, go ahead.
Okay, so we are back. Welcome to the work session on LD 1932 as amended.
Okay, so there's a lot of paper here. I will skip over some of it and I will make you listen to some of it.
Yep.
So first of all, I do want to draw your attention to the second thing after the bill analysis, which is the new amendment language. It may be yellow.
Yep.
Yes,
Yep.
that's good. And I did also include somewhere, I think on salmon, which is the markup. And that's just if you need to see all of the history of the original amendment, then, I mean, the original bill, the amendment you got at the public hearing, and then the one that's been added to it. And it's really just, and if you want to see where it all came from, but the clean version is yellow. So, so some of the summary, I will go over, and some of it I will adjust as I go. So as you know, this bill was originally drafted around changing the reimbursement for services provided by direct care workers. And it was going to be changed to 140, but that has been replaced in this amendment with a 1-year COLA. So I'll come back to the COLA in a minute. And then the next couple of bits were removed in the amendment. So I'm going to go down to the next one. So actually, I'm going to go past that as well. I am going to go down to the third paragraph from the bottom. The bill also requires, the way it is drafted at the moment, DAFs to provide a biennial report to this committee with estimates of the actual cost to the state of providing all long-term care services and forecast costs into the future. Thank you. And the amendment changes the date because it was a carryover bill. The bill changes, and in the amendment, it changes the membership of the Essential Support Workforce Advisory Committee to include a representative of the Long-Term Care Ombudsman Program and a representative of an organization that provides personal services in the home. So that is in your clean copy. And then the bill requires DHHS to convene a stakeholder group to develop the Innovations in Care and Support Technology Plan. And the purpose of the plan is to advance the use of technology to reduce the number of approved but unstaffed essential support worker hours. That's Section 8. And then the bill requires the department to create a stakeholder group to assist the department in developing a 5-year plan to expand the department's worker portability and advancement initiative to establish a standardized curriculum and training program for essential support workers. That the amendment changes the report date and adds to the membership and organization advocating for individuals living with Alzheimer's or dementia. The new amendment replaces that 140% language and available resources and so on with a one-time COLA. It is drafted as 3.1%. It's actually going to be 3.07. So feel free to write that down. And that COLA is drafted to be applied at the end of the current year that received those partial COLAs in the last 2 budgets that you did. So if you remember, there was a 1.95% followed by a 1%. And they would be applied at the end of that 1%. So you can't go back and fix that and make it whole. It would be a whole COLA, for want of a better way of putting it, in the next year that follows. The reason that's a little bit complicated to explain is because some of the COLAs would be applied to the 2027 calendar year, and that is most of the main care ones. And some of them would be based on the fiscal year. In other words, they would start July 1st, and that's all of the state-funded ones plus Section 40, which is home health services. The reason for that, and my understanding is that it's a practical, it's so that it's a workforce issue. I mean, workforce for the department issue. So they split it up because it was a lot to do for every section of main care and every section of the ODES. And so some of them start July 1st and some of them start January the 1st. That is the same for the partial ones that you applied. So you would just be following which, yeah, exactly. And so some of them would start July 1st of this year, and some of them would start January 1st of the next year. And that is right in the amendment. You can see which sections that is.
Where is that? The
Uh,
amendment?
So
Just
the
wanna see it.
amendment, if you go to the the end of it starts on the bottom of page 3. So there's the COLA adjustment for essential support workers. And then you can see there, it says implement a cost of living adjustment that would be 3.07% for reimbursement rates subject to section 40. And then also, why does it say that? Yes, effective July 1st, 2026. And then all of those other sections of main care would be effective January 1st. And then the section 12 is the state funded ones. The reason we split them up is because you have to go to CMS with the main care ones. You don't have to do that for state funded services. And the state funded services would start July 1st because that's when their COLAs go into effect when, you know, that's the intent. And then of course there would be an appropriation section that would go along with that. So that's where that is. And then, the other thing that is in this new amendment, which is in I guess I forgot to highlight it here. It's section 7. It's replacing what was in the original bill and then replacing what was in the amendment, which was really, the amendment you got at the public hearing was actually a placeholder because you hadn't got the report yet when the speaker had to prepare his testimony and his amendment. So it requires MHDO and DHHS to work with the vendors to develop the data for reporting the care gap. And I'll have some more information on and actually, Karen Lee is on Zoom, if we could let her in. Is that all right with you?
Sure.
If Karen Lee is there, can you let her in? Thank you. What do I need to go through here? Hang on a minute. So some of the things you heard at the testimony were based on the Essential Support Workers Advisory Council recommendations. I did send you that report earlier this week. It had been done, but we hadn't received it, but you have it now. You heard about the MHDO work from 977, which we'll talk about a little bit more in a minute. And then the department was opposed to the bill. There were some things that they were in agreement with that were in their own department bill, but I'm going to skip over most of that. There were some additional amendments requested. Okay, so the requirement for the biennial report. This is the one that is right at the beginning of this bill that is currently drafted as DAFs. This is section, it's right, if you look at the yellow, Senator, it is literally the one that's right at the top.
Yeah. Okay.
So
underline.
Yes. And that is straight out of the original bill with the exception of the date. So this was drafted as DAFs providing this report. I can't remember why, but it was my fault. I'm sure I had some logic at the time, but the paper trail has gone cold. So the report requires the total biennial cost for services under main care and the state-funded program provided by essential support workers, including the projected costs if all services were provided. I do know that DAFs reached out to the Speaker's office and whether this report should be provided by DAFs. Like I said, I can't remember why I drafted it that way, but one could see why you would expect DHHS to do it. So it might be more appropriate. There are some other reports that are already required that we could talk about.
Yeah.
Do you want to do it now?
That's my question. Yeah.
Okay.
Do
So-
we have other reports that are already in statute, already required, that some of this can be added to?
So yes, but there's also a sort of a bit of a problem or a bit of a sort of intermeshing problem here. So there are a number of reports that you receive, and I listed out some of them at the end of my bill analysis. But also you have what Sophie just handed out for me. This is the one that you do receive this report, although you didn't used to. Well, it's a fairly new one. But so this is a report every 4 years that the department puts together. You have it. I sent a hot link to you in your bill analysis if you wanted to look at that. It's a current allocation of resources for long-term care and the goals for allocation of those resources during the next 4 years. The report must be based on current and projected demographic data, current and projected consumer needs, and recent or anticipated changes in methods of delivery of long-term care services, and must include any action taken by the department, both at the state and federal level, to further these goals, and any recommendations for action by the legislature. You could read that as already kind of including that sort of information. The other problem is the care gap, which we can talk about in a minute with MHDO. That's not something you can just slide in there yet because it's not happened yet. This bill is still still sort of figuring out how to go about doing that. So it's up to you, but if you do want to do something like that, you could either make some kind of change to this section 50 in statute, but it isn't entirely clear to me how you want to word that, but that's up to you. But so we can come back to that if you want to talk about the care gap first, perhaps, because I think it's not unrelated.
Yep.
Okay. So MHDO, Karen Lee is up there on Zoom, and she presented the report to you a couple of weeks ago. And I'm just sort of paraphrasing your recommendations in your report, Karen Lee. So for main care services, OMS could work with the vendors and MHDO to create a supplemental file for the care gap. There would be a cost associated with that. Also, and I can't answer the details of this, and maybe Karen Lee can't either, but OMS is apparently going out to bid for a new system, so there would be a freeze on change requests. I don't know how this complicates this or not. And then for the owed services, which if you remember is the harder part, because there's no prior authorization system, so it's much more it's more complicated. A lot of it is monthly cost settled contracts, so it's not the sort of fee for service idea that you have with main care. So there would need to be modifications to the current data tracking, collection, and reporting structures for those state funded services for ODES in order to be able to move forward with enough information to even develop that report, and that would also require funding. So there is language in here that is trying to put that into this amendment. I do want to point out that the version that I sent you left out a couple of main care services, but the version you're looking at is corrected. There's always a sharp eye that catches your mistake, for which I'm eternally grateful. So I don't know if you want to move forward with this language, you may want to see where, because I did send it to Karen Lee because I didn't know if I had it exactly right.
Okay, so Karen Lee, welcome. And just your thoughts on what our analyst has been discussing with us as the possibility for amending this section.
So good afternoon, everybody. I think what is reflected, and I'm looking to the side because I'm looking at my other screen with the bill. I think it's reflective of what is in the report with just maybe one comment, and I don't know if we can work offline to address this, but essentially in the number 1, where there's a reference to sections in the main care benefits manual. Yep. We had noted in the report that sections 23 and 26 and some services in section 65, which is
It's
mental
health.
Yes, do not require prior authorization. And so measuring a care gap might be a little bit different for those sections. And I've read this a couple of times and I thought, well, you know what, I think maybe it's fine if it stays in here and we figure out if there is a way to sort of measure. Because I mean, essentially what you're trying to understand is what people are being authorized to receive, or they've been certified, or whatever the right term is, are they getting it?
Yeah.
Or not? And so even though that's in a section where it talks about prior authorization, and there is no prior auth for those services or sections of policy, should it be in there or not? that was just one thing. It's kind of a very technical thing, but I thought everything else was consistent with what we had reported.
Okay. Can we leave it in there for now, those sections?
Or just have a
That's the way
little
we're gonna-
clause that mentions that about prior authorization. I mean, either way, I think it should stay
I
in.
think we can add some language to that, Karen Lee, to make it clear. I think that it wouldn't be exactly the same sort of supplemental file, I guess is what you're saying, right? That it would be created differently.
Yes.
So we can massage the language to do that. I don't know if you want to know what those sections are, because I remember having to look those ones up.
23, 26, and 65?
Yeah, and 65 is the big mental health one.
Yeah.
So that's
Yeah, what's
that's
23 and
that's a
26?
big bucket. 26 is day health, and 23 is developmental and behavioral clinic services. I don't know if that's a big one or not. I had to look at that one. I knew what 26 was, but 23 I wasn't familiar with. So the only reason I say that is because I don't know if that's a big program or not.
Mhm.
It may not be, but we can ask the department
Okay.
about that
Yep.
later on. But 65 is a big one.
And there's just to add, there are just a few services in 65 where there isn't. But I mean, my thought is if you leave it in, I mean, we just figure it out whether we use authorization data or not.
Right.
If that's not available, we don't use it, but we figure out if there's some other way to measure what people are not receiving.
Mhm.
So I'm just raising it because technically it is
Not the same. Yeah.
exactly.
Okay. Good to know.
Okay, so are we in agreement to moving in this direction using this report?
That's up to you.
I'm asking the committee if it makes sense, to use.
Replacing, let me just clarify, replacing this section by adding language to this, put it in here.
Yep.
Yeah. The only thing I noticed that's different is this talking about every 4 years, that I think they said something about every 2 years if it's the same piece, or I'm looking way up at 12 there. Okay. All right. Never mind. Got it. Want to make sure.
That's the biennial funding.
The reason it's related, Senator,
Yes.
is because the question is, if you don't have the care gap information available yet, because this is going to take time for them to move forward with, does that affect any kind of language you want to add to this section 50 about this 4-year report? Like, are you putting the cart before the horse? Do you need the data gap information in order to get this kind of reporting that is that estimates the actual cost to the state of providing all long-term care services? I think that's
Okay.
the question that
Okay.
that you are getting at.
Yeah, it is.
Okay,
You want me to move on?
yes, please.
Okay, so I'm gonna skip. You did ask for some information. I believe it was Representative Shigori asked for some information about pay, and you have a couple of things there. You have the PHI information that I gave you, and you also have some information from the very nice lady at Leading Age who brought you a memo as well. So that is in response to the request. And then, so the credentialing direct care initiative, you asked for an update on that since that is in this bill as well. So I don't really know if you want to, I'll just read it out. So this is from ODES, from DHHS. ODES has already made meaningful progress on the credentialing and workforce development goals contemplated in LD 1932. A standardized direct support worker curriculum has been developed and is currently being rolled out to interested private pay personal support service specialists. Try saying that fast, organizations. This curriculum establishes a consistent, portable foundation of core competencies and aligns with national best practices in the direct care workforce. Statewide implementation of The direct support worker curriculum for main care funded services will require amendments to multiple main care rules to ensure the training can be formally recognised and reimbursed. These rule openings are already anticipated due to the need to address updates to the grievance process, and ODES expects the curriculum language to be incorporated as part of that broader rulemaking effort. ODES has been clear with stakeholders that the development and full implementation of stackable credentials as a longer-term workforce strategy based on experience, other states and national guidance. ODES anticipates this work will take approximately 3 to 5 years following the complete state rollout of the curriculum, and this phased approach allows for thoughtful implementation, evaluation, and alignment with reimbursement and rate setting processes consistent with existing statutory requirements and ongoing rate determination work. So you asked for that because you heard from the department during the public hearing that they were already moving forward with the credentialing. So that is section 8 or 9.
8 or 9.
Yeah.
Is that 8 or 9? 9.
Okay. And then I don't know why I put it in this order. And then the other one, which relates to section 8, you asked for information on the technology plan and the council from DHHS. ODES has been actively engaged in technology-focused workforce and service delivery discussions and is already taking steps that align closely with the intent of the bill. The department has worked with national partners and experts to explore how technology can enhance service delivery, improve workforce efficiency, and reduce the number of approved but unstaffed support hours. Beginning in March of this year, ODES proposes to formally launch its next phase of this work by participating in and drawing down from the National Association of State Directors of Developmental Disability Services and the Advancing States Enabling Technology Engagement Group. This national initiative will help inform Maine's approach by providing access to peer states, evidence-based strategies, and emerging practices related to enabling or assistive technologies. The ODES also plans to convene a technology council in the summer of 2026. This council will bring together internal DHHS leadership, providers, advocates, individuals receiving services, family members, and national experts to help guide policy development and implementation. The council's work will inform the department's broader innovations in care and support technology plan, ensuring that technology solutions are person-centered, ethical, and responsive to Maine's workforce and service systems realities. In addition to this forward-looking work, the department has already engaged in practical near-term technology discussions, most recently as part of the DHHS Office of Aging and Disability Services long-term services and support system reform. ODES engaged in a dialogue at their most recent Innovation and Quality Advisory Council on the use of artificial intelligence-supported transcription in nursing home settings, reflecting the department's broader interest in responsibly leveraging technology to support both workers and individuals receiving services. And the department believes this integrated approach will allow Maine to move more efficiently while remaining aligned with national expertise and existing statutory and regulatory frameworks. And then, so that is the other section 8, I guess, of the bill. And then the other question that you had, you asked for a timeline for the sections 21 and 29 rate review implementation, including a budgetary estimate, and DHHS. The department is aiming for CMS approval of its lifespan waiver application by October 2026, although the actual approval date is dependent on CMS and implementation is contingent on numerous systems and process changes that the department is working to have in place. The department has requested and received other appropriations related to implementation of the lifespan waiver in the past and does not plan to seek additional funding at this time. The home and community-based services clinical rate study is still in progress, with draft rates anticipated to be presented publicly this spring, and so the department has not requested appropriations for this work at this time. So those are all the things.
Do we have a copy of that?
A copy of what?
Of that memo you're reading?
It's attached to the blue.
Is
It's,
it?
yeah, it's like
I
the last couple of
pasted
pages.
in from my email.
So-
It's on the last page of the blue, Senator, and it's right at the top.
Okay.
Yes.
I saw the timeline.
Can you?
Patricia.
I'm sorry.
Yep.
I'm sorry.
Go ahead.
Thank you, Madam Chair.
find it.
Anna, thank you for the presentation. And you had a line you mentioned about the long-term care services and support systems reform underlined. Is that a link to the report?
Yes. Now,
Okay.
bearing in mind, this is not my link. This is, yes, but I sent you the email with this in it. And so you can go through the email and get the whole link.
So with regard to 8 and 9, it sounds like there is work in progress. There's been work done. I would like to know more about that. So I assume that, yep. Welcome.
Thank you. Hey, everyone. I'm Abby Stivers. I'm the Director of Government Relations for the Department of Health and Human Services.
So can you, based on the response back on both of these issues, maybe you can enlighten us on what's been done around credentialings and credentialing curriculum and infrastructure. With 8 and 9, I need to understand where are we at presently?
Yeah, absolutely. And it is my pleasure to talk about this, as my former role was Director of Workforce Initiatives for the Office of Aging and Disability Services, where I got to work on some of this work directly. So starting with Section 9, the credentialing and training redesign, a lot of this work happened at the start of the 9817 funds that were part of the additional funds that the department got. So work started to help with these efforts in 2021 with looking at national best practices for curriculum, what other states were doing, looking at what could be done across states and what was already available to purchase. All of these updates, by the way, are available in small sections of the Quadruple A reports on the ODES website on the initiatives section for this kind of stuff. The department worked on curriculum that created a core competencies curriculum, which includes the personal support specialist, the PSS curriculum, along with the core components of the DSP, direct specialist provider. Yeah, to create the direct service worker course, the DSW course, which Anna mentioned is already being used by some of the private play personal support specialists. We're waiting for a larger adoption of that course until CMS has approved some of the rule changes that are needed, because right now in statute it says our older course is approved, so we're making some language changes. So a lot of that work has been done. As part of that work, in 2023-24, the course was vetted by national vendors, including PHI. It was also opened up to a lot of our statewide interested parties, trainers, provider organizations to get their feedback as well, and that was incorporated into the work. So to put Section 9 into statute at this point would be having the department go back and do work that has almost completely already happened. And so there would just be an additional cost to that as well.
May I?
Yes.
Is there anything you notice in Section 9, like the plan requirements that are listed out here? If you can look at that is not included in the work you've already been doing.
I'm not sure that the way that the work was done is exactly in line with the language. And that's really part of why we would, request or suggest that sections 8 and 9 are not needed. And I'll talk about Section 8 in a minute, just because establishing a 5-year planning framework with defined outputs, timelines, and reporting requirements. I'm not sure that exact 5-year timeline sort of document happened, but planning documents certainly did, which were more along the lines of, we need to talk with national partners. We then need to talk to, we held a couple of statewide stakeholder groups to see what was working in the training and what wasn't working. Those were invaluable meetings where we learned things like folks taking our PSS and DSP trainings were very unhappy with how much reading was involved in the course. It was very reading heavy. I don't believe the textbook for the course was available anymore, and the textbook only covered about 15% of the CNA textbook, which is what it was actually made on. Maine's curriculum efforts for personal support specialists for aging specifically have been really at the forefront. Maine was one of the first 5 states to have curriculum to train folks to work with our aging populations. So the curriculum that we have, this new curriculum, is an improvement on that sort of top CNA textbook that was in place before. So sorry, Senator, to answer your question.
No, that's good.
This 5-year timeline, I'm not sure that it exactly aligns with what is exactly here.
Yeah.
But a lot of the I think the intention behind the work was done, work plans, planning to how to make these things go forward. those kinds of things were done. Similarly, in section
Can
8.
you just, before you go on to section
Go
8,
ahead.
so did I hear you say that some of this has already been rolled out to the personal support?
So right now, it's
Folks.
just been launched. The new DSW course has just been launched for the private pay personal support
Okay, so for
specialists.
for that cohort of folks that are already using this, what's the feedback?
I've heard good feedback so far, and I haven't heard too much, but the course is a hybrid course. It's online. The department was looking to have it translated into a couple of different languages. It was done in a way to try and make sure that it was interactive when possible. The course is also fully narrated so that you don't have to read. You can listen as if you're an instructor. You can also read along. So it also adheres to CMS core competencies best practices. So our national partners, again, PHI was really impressed with what we've done, and we're excited to share it when we have the opportunity more with those rule changes.
And we're waiting on CMS approval for use
We're
with the
waiting.
rest.
Yes, we're waiting for the opportunity for rule changes. I'm not sure if it's
Okay.
technically with
Yep.
CMS in the process, but we are waiting to change those rules to then launch it statewide.
Okay, time frame for that, or
I can get back to you on it exact.
but whatever
timeframe.
it would be sooner than starting over from scratch.
Much sooner, and we are looking to do that as soon as possible. I mean, it's in with the priorities of the rest of the department and with the Office of Aging and Disability Services, but it is, it is something we look forward to doing. It's a good course.
So, and
Go ahead.
section 8 then. Are you ready
Just
for
section
eight?
9, I just want to ask a question. You'll be able to come back to us with some kind of report on how it's going and what it looks like?
Sure, yeah. Whether you'd like, me to work with OMS to see if we have a tentative timeline or a formal report, when you come back into session, whoever, if you come back. Orientation, that's a great point. Anna's,
Thank you.
we would be happy to provide an
Okay.
update on that at orientation. Yeah, that's a great idea.
So section 8.
Yes. As Anna ran through and when we were talking about this, this is work that the OADS, the Office of Aging and Disability Services, has also been really committed to. As part of the 9817 work, there were some technology initiatives. One of those was the HCBS Innovation Pilot Grants, which was looking at this. The current work in March is with NASD's looking at the national best practices of what technologies are available. How can they help with service delivery and with workforce? Those are the two main areas. So we're in those conversations now. And then the council that Anna mentioned is something that we've planned in the upcoming months. So again, to meet the requirements as written in the bill, OADS would just need to designate a staff lead and provide ongoing facilitation, coordination. It would be far more structured, which would just be a little bit more resource dependent. That work hasn't happened, but it is ongoing. It would be an additional cost, though, for work that the department is already committed to doing and is excited to do for the state of Maine.
Questions from the committee, from anybody? Seeing none. Thank you, Abby. So it sounds like we've got a plan for section for the reporting. Is that section 3? And it sounds like 4, 5, 6, and 7.
If what I'm hearing from you is if you were taking out 8 and 9, which
Yep.
I'm not making that call for you, but that's what I'm
Well,
hearing
that's
you
where I'm
say,
going.
is you would need section 7, which is the MHDO part.
Yep.
And then you would need what is basically section 11 at the end here,
Yep.
which is the COLAs.
COLA piece, yeah.
And there is, I feel like there was something I've left out.
Was the additional membership?
Yeah, that's what I'm just looking for, Senator. I feel like I might have missed a bit. Hang on 1 second. The question still is what you want to do about section 3. And that's what I don't know, which is the report, whether you want to do something the way it's drafted right now, the way it is in section 50, or whether you want to wait for the care gap report. Actually, you could
Yep.
include it into the care gap.
Yep.
Some kind of long-term thing. Oh, here's one. No, I'm looking for the original. Hang on a minute. Sorry. I feel like I may have left a piece out. Section 5. I do still have it, right? I didn't lose it entirely, did I not?
5 and 6 remain the same.
Oh, yes, thank you. So section 5, this is the one, this is the Essential Services Workforce Advisory Committee.
You added 2 people to.
Yes, and then 6. Oh, yeah. The report required by 282. Oh, so that directly actually ties to section 3. So
6 does?
yeah, so whatever you decide to do with this reporting will also affect that. So this is a report that requires, what report is that? That is this report, right? That report. Oh, I know what I'm doing. I get it now. This is one of those situations where you have to write something sort of non-specific in statute, and then you write the unallocated language to say this is what I really mean.
Yeah.
So this is the same thing. So it doesn't change the question here. The question here is what you want to do about the reporting at all, and whatever you decide to do will impact what we do with section 6.
Yeah.
So yes, so section 5 would stay under this current amendment.
Yep. I think using this report.
Yep.
And including Karen Lee and her recommendations.
Right. So the issue with that is that it requires the MHDO work to happen before you can kind of refer to it, if you get what I mean. So we can't like cite the care gap in any way into this report. Perhaps what you could do is, although I'm not quite sure how yet, is
what about pushing the dates out?
So perhaps there's probably, hang on a minute. So this report from MHDO, following all of these modifications, which, assuming you get it off the table and moves forward, MHDO would be submitting an annual report to this committee and to AFA, and it contains data on the care gap. That might be the time when you would want to put that specific information into somewhere in statute where that's required, but I don't honestly see how you can do it right now. So I guess the question for you is how much of this information of this, this is obviously biennial and this is a 4-year report.
Yeah.
And it's the total biennial cost to the state for all approved services under the main care program and state funded programs provided by essential support workers. This language is a current allocation of resources, so that's what you're spending now, and goals for allocation of those resources. The report is based on current and projected demographic data, current and projected consumer needs, and recent or anticipated changes in methods of delivery of long-term care services, and must include any action taken by the department to further those goals and any recommendations for action by the legislature. So I don't honestly know how much of this is not in there. That's maybe a question for you. Obviously, it's your call, except that you can't refer to the data gap yet.
Yep.
Right.
I know.
So I suppose one option, although it's a little bit awkward, because MHDO can't be the one that submits a report to you that says, oh, you could put this information over here in
Mhm.
section 50, because that's not their bailiwick. That's
Yep.
not what they do.
Yep.
So I'm not quite sure how to get at that, but maybe there is some way to have some language in there that once that care gap information is available, that it becomes part of this 4-year
Mhm.
report. But I'm not quite sure how to do it, but you do have authority to report out a bill. So I'd love to say I could be your institutional memory, but my memory's garbage. But you know, that would be one way of doing that, is when you get that report that has that care gap information, you could take that information and do whatever it is you need to do for the MHDO report and the care gap and however you want that to be presented to you. And then you could include that in one of the other reports that you already received. But it would require somebody to remember that that was an idea. I don't know how to do that. That's the
Well,
best I got right now.
It's, this is recorded. We can play it back.
I don't want to go back and listen to myself.
Well, we can. But I think that's what we're trying to get at here.
Right.
So I think we could take a deeper dive in that.
Yeah. I mean, there might be some way, like I said, we could probably add some language to that. It is a bit awkward because we can't expect MHDO to come up with that, but there may be a way to include something in here that the committee could consider amending statutory reporting requirements to include this care gap language somewhere else. I should write that down before I forget.
Yeah, you
it, don't
should. Someone should write that down, because that is where I think we're going here. So that's the plan for that section. We're thinking we're going to strike 8 and 9. The rest of it stays.
Actually, you're now striking 1, 2, and 3.
Yep.
You're striking 4.
Yep.
You're keeping 5. You're striking 6. Yes, because that's the one that relates to what we just talked about.
Yep.
You're replacing 7.
Yep.
And striking 8 and 9. Is that right?
Yep.
And then there would be obviously an appropriation section.
Yeah, section.
Yes, and then there would be the COLA language plus whatever
Yep.
fiscal note comes along with that.
People probably really mutilated it. Yeah, they mutilated themselves.
No.
I know. That's right, we own it now.
Okay, so any further discussions, suggestions, recommendations, thoughts? Questions? We know where we're going with this. So I'd entertain a motion.
I move LD 1932 as
Amended.
amended, as just described by our wonderful.
Okay, there's a motion.
A second.
Second from Senator Ingerson. Any further discussion? All in favor?
Thank you.
Holy cow.
Okay,
I understand. I got it.
we have concluded our work for the day. I'd entertain a motion to adjourn.
Move adjournment.
See you in the morning.